And here is your question.
Wow.
Right, so if you have read and understood, considering it critical care scenario, kindly tell me, how would you manage this patient now?
Yes, I would manage this patient according to the retailers protocol following the
Yes.
ABCD approach.
Yes.
I will initially assess the airway. For the
Yes.
airway, I'll look for any foreign bodies in our mouth or any discharge. Then I will evacuate that with the measures force or suction. I will
Yes.
also stab
Yes.
and feel for the breath. Then if that doesn't help, then I'll go for airway adjuncts like nasopharyngeal or oropharyngeal. Then I will also consider intubation if that doesn't help. Then I'll go for breathing. Breathing, I'll check for respiratory rate, chest movement, tracheal position. I'll percuss and auscultate for any abnormality. Then for
Yes.
circulation, I will check for pulse blood pressure, capillary refill time. I'll also, if I can put a central venous line, I'll check for central venous pressure and put catheter, monitor the urine output. And I will also connect two wide bore cannulas and
Very
start
good.
rehab.
Okay. Can you please tell me if you fail to manage if you fail to bring back the temperature of the patient, because as it shows, it's about 26.4 Celsius, and if you fail to manage it or bring it back to the normal, what are the complications that you expect to find?
Yes, it is severe hypothermia case. So there could
Yes.
be multi-system affection. Like in the cardiovascular patient will have decreased cardiac output, cardiac arrhythmia, and vasoconstriction. On respiratory patient will have increased pulmonary vascular resistance and VQ ventilation proficient mismatch. There will be decreased ventilator drive. And in the renal, due to decreased renal blood flow, there will be acute renal failure or AKI. In the
How would it
hematological,
affect neurologically? Yes, please.
neurologically, due to decreased cerebral blood flow, the patient will present with unconsciousness, or patient can also lead to
You
coma.
you said it is a case of severe hypothermia. How do you classify hypothermia?
Uh, Mild,
What
moderate,
is
and
mild?
severe.
Yes. Which range is considered as mild? How do you measure core body temperature?
We measure the core body temperature through the rectal, esophageal, to the urinary bladder, to the pulmonary artery catheter, and yeah, ma'am.
Okay. And the other question we'll discuss at the end. Okay. Can you please tell me if this ABG, which is given in front of you, how would you interpret that?
Yes, patient is having metabolic acidosis with hyperkalemia.
Yes. How do you intend to
And
correct that or manage that?
yes, I will correct the uh, initially I will correct the hyperkalemia. I will start patient on injection calcium gluconate 10%, 10 ml over slowly over 10 minutes.
Yes.
Also consider injection insulin in
Yes.
50 ml 50% dextrose over 30 minutes. I will also consider sodium injection sodium bicarbonate to correct the acidosis. Then if it doesn't help, then I'll also go for like dialysis, hemodialysis, ma'am.
All right, that is the last resort. Okay, can you please tell me how the body manages the body temperature? What is the mechanism behind it?
It is mainly controlled from the hypothalamus, ma'am, through the
Okay, very good. Then
hypothalamic function, and also through that through the normal body mechanism, whereby
how
they,
signals are sent through which pathway? Can you tell me the whole thing, please? Hypothalamus sends signals where, and then how the mechanism takes place. Like, I want you to tell me the whole pathway and then come back to the conduction, convention, evaporation, and radiation.
get back
thing.
to
Yes.
that later, ma'am.
Okay. Can you tell me these factors? What do you understand by convection?
Yes, convection means the heat is lost through when the wind displaces the layer of warm air near the skin, ma'am.
Okay. That is all right. Okay. Can you please also tell me how would you take care of the nutrition of the patient in this situation?
In this situation, I will consider a patient on starting on total parenteral nutrition.
Yes.
I will preferably start through a central line, ma'am.
Okay.
And since this is a traumatic case, I will consider giving increased nutrition than the normal need, ma'am. Like I will
Okay.
give 45 to 55 kilocalories per kg.
Okay. Just suppose you fail to revert the patient. What is the last resort? What is the last alternative that you'll go for before giving up that, okay, you can't bring back the patient to normal?
Get back to the later, ma'am.
Okay. Can you also tell me, right, why the patient has presented with metabolic acidosis? What is the mechanism behind that? We can discuss the mechanism behind.
The patient.
Okay, a very easy question. How the homeostasis takes place?
What is this, ma'am?
Homeostasis in the vessels, blood vessels. How does that takes place?
Hemostasis, ma'am.
Yes, please.
Hemostasis, it has 3 stages. Initially there's vasoconstriction.
Yes.
Then there's platelet aggregation, activation, and platelet. Then later there's platelet plug formation. Then with the activation of the coagulation system, there's a
Okay.
A2. There's
can you please tell me how do the normal people generate heat?
Yes, they generate heat by the normal body mechanism, like shivering, and also
Okay.
there's
According
autonomic
to
function.
the NICE guidelines, where would you manage this patient and who would you involve in the management of the patient?
I'll manage this patient in the ITU. I'll involve the ITU register, anesthetist, and I'll also involve the.
Yes. Can you please tell me during the surgery, if like you have to operate on this patient or something, the patient also becomes hypothermic? Why? Doesn't have to be this patient, just any other patient if you are operating on it.
Yes, it could be because patient has abolished behavioral responses. It could be because of the cooling effect of anesthetic drugs. patient, it could be because patient's body is exposed and is losing heat. It could be because of patient has reduced
So
hypothalamic
what
function in
happens?
response.
Because patient is exposed, so there is more pooling of blood, so there is vasodilatation, and there is shivering going on, and what else?
And also
Okay.
there's reduced metabolic heat production and also
Yes.
reduced muscle activity.
Yes. Okay. So what would be the ideal way of warming up the patient in that situation?
We will start with we'll initially remove the wet clothes of the patient, and then we will start with warm blankets, increase the temperature of the room, and also if that doesn't respond, we can give warm IV fluids. And also in the later stage, we can also start patient on peritoneal, warm fluids in the interperitoneal cavity. And also in the urinary bladder, we can use warm fluids.
Okay, can you please tell me, can you please tell me what is the normal core body temperature? When would you consider it as hypothermia? What is the range?
Even
Yes? Your voice, I can't hear you.
when the core body temperature is below 36 degrees centigrade.
Yes, 35. Yes. Below 35, good. And when would it be severe? What should be the temperature? Anyone else who are going for the exam can tell?
Dharma.
It's Dharma.
This is not.
Clinic,
This is not Dharma.
This is not Dharma. She
Anxious
asked,
mother.
yes, anxious mother. She
She
wrote
asked for
anxious
Dharma, I
mother.
think.
She asked for Dharma.
Dharma
Yes,
splenic
Didn't you say
hematoma.
mother? Sorry. Dr. Karma is helping you. Right. So if you have read and understood, considering your communication skills station, kindly begin.
Hello, I'm Fozia, one of the surgical doctors here. May I confirm your name and age?
Yeah, it's Tom, doctor. I'm 48 years old.
Nice to meet you, and thanks for confirming. How would you like me to call you?
Yeah, Tom is okay.
Thanks, Tom. I have been told by the sisters to talk to you about that you want to leave for home.
Yeah,
I want
doctor.
to talk to
I
you
want to
about
leave.
it. Is there anything that I can do to make you stay at home, at hospital?
No, doctor, you can't do anything. I need to leave the hospital and I can't stay here anymore, doctor. I just want to leave.
I'm sorry. I understand that staying at hospital is quite disappointing and frustrating. But could you please tell me how far you know about your health condition at present?
I'm fine, doctor. I had this motor vehicle accident, and then now I'm fine. I'm doing fine, doctor. So I need to leave. I've many issues at home. I need to go.
Well, could you please could you please tell me is there anything else that you know about your health condition?
Yeah, they
What,
said I have this rib
what do you
fracture
think?
and all.
What do you
So,
think
but
is
I'm
going?
feeling fine, doctor.
Uh,
So
I think
I'm feeling fine, totally fine. I have mild pain, but I'm feeling
it's
fine. So I want to leave.
it's good. It's good that you are feeling fine, but I think you have incomplete knowledge about your injury, and I'm here to discuss about it first. You are right. You have a rib fracture on your left side, but apart from that, you have injured an organ that's present here on the left side of our tummy, and you have injured that too, and you have small blood collection around its beneath its covering, and the condition is called as splenic hematoma. And the
What is
recent
that, doctor?
as I told you, spleen is an organ which is present in our left side of our tummy. And as you have injured your abdomen, and there is some blood which is collected around, which is under the covering of the same organ, the spleen, and it's contained, and you are stable at present. But as I was going through your notes, your HP has dropped from 12 to 10, which is suggesting that it could be bleeding, and it's a
What's
Hemoglobin.
HP?
serious
What
condition.
is HP?
What's
Hemoglobin.
HP?
HB is hemoglobin, and it's the blood amount of hemoglobin which is present in our blood.
Okay, okay.
It's
So
it suggests that it could be bleeding, and it's a serious condition, and it is a life-threatening condition if it will bleed.
but how
So
come I'm feeling fine? You're saying it's
um,
life-threatening, but I'm feeling fine, no?
yes, because the clot is there and it is stable. You are at rest in the hospital. That's why I'm suggesting you to stay at hospital and get yourself treated first. If, God forbid, there happens leak from the clot, it could you could get seriously unwell, and it could be threatening to your life.
Yeah. So you said it's content and I'm feeling better. So I can leave, doctor, right?
In my opinion, you should stay. Is there
I
anything?
have problem at back at home, I'm having a sick wife. She's having cancer and there's no one to be with her, you know. So she's alone at home. I need to go back.
I'm really sorry to hear about it. Is there any friend or relative whom I can call to be with her?
No one. I have
Uh,
no one, doctor.
Maybe I could
I'm the only
arrange
one to her.
I could arrange the social workers to have a look around her during the time you are in the hospital.
No, doctor. She won't like that. I want to be with her, and then I want to take care of her. I don't want other people, So I would want to go.
Mm,
And then there is interview as well.
is there anything, anyone, or any possibility? Would you like to talk to your wife?
Yes, of course I want to talk. I had a talk with her in the morning, today morning. So now I want to, be with her. She's not doing well.
I seriously think you should rethink staying at the hospital and get yourself treated, because when you are in a good health, you could take care of her well too.
On top of that, I also have this job interview after a few days, and so and I'm already having a financial crunch. So I need to go,
Uh,
doctor.
I, I can
Please
I can
understand my condition.
uh, I can understand. I'm sorry. but maybe we can talk to the interviewer and postpone your interview, or if it is possible for the employer, we can arrange an online interview for you. Would that be fine?
Digital, yes.
Would that be okay?
I don't think that's okay, because everyone is going in person, and then the interview cannot be postponed. Everyone is coming on the same day. They won't accept it for me to be postponed.
But
And it's very
uh,
important interview for me. I'm going to have, increased pay with that. So it's really important, doctor.
I really appreciate you, but health comes before wealth,
Don't
and
appreciate. Say, I really understand your
I really understand
situation.
it, and I think you should reconsider watching out for your health
How
first.
can you understand, doctor? You're not in my state. How can you understand my state?
I'm sorry. I'm sorry.
It's
I'm
not
sorry.
going well, Dr. Fazia.
Yes, ma'am.
You're not
I'm
supposed to be sorry in this way.
okay.
Okay, check the
Okay, ma'am.
competency check. Do the competency check. Make
Could
sure
you
if patient is understanding what you're telling.
could you please tell me what we have been through this time?
Yeah, doctor, you said
So,
that I have this fracture, and then there's some blood collection in my this spleen or something, and then my blood is decreasing, and there's risks that it might continue to bleed, something like that, and
yes,
then it might also risk my life.
and she
Well,
advises you to stay at
uh,
hospital.
Mm.
Yes.
you're well within your rights, and in my opinion, you should stay at the hospital. But you can self-discharge yourself. It's a
Yes.
legal document stating that I have explained to you your condition, the benefits of
Okay.
staying at hospital,
Your
and the
time
risks
is
involved.
over. Now, Dr. Kama will give you feedback. Yes.
Thank you, Dr. Fozia.
Yeah. At the end, you
Uh,
had to summarize. All right. So, yes, please. Where you went wrong. Maybe the
uh,
concept was not clear in your mind that Dhamma patient will be angry, and here Dr. Karma was not so much angry, but the patient will be quite irritated and would not answer you as politely as Dr. Karma were answering you, and you had to be more confident with whatever you're saying. And like if you say no, I'm sorry, like this way being sorry is like you're just dropping in front of the patient, angry patient, and here it is wrong. Be apologetic, but not in that way. Like you have to keep your dignity as a candidate as well. And yes, you spoke hemoglobin. Okay, maybe you could have said there is a component in the blood, and because of this incident that you had, it has dropped, which is alarming because it can even lead to consequences. So you could have said like this instead of just using the jargon. And then you explained, and then you should have taken care of the wife issue. You took care of the interview issue that you said we can even arrange it online or digital for you instead of and then competency check. And now you were telling about the legal signing of the legal forms, and at the end you had to sum it up. So this is from me, because you were not so much organized today, so you couldn't complete it. What is your feedback, Dr. Karma?
uh, I think her voice seemed not confident. That's why I ruled over her.
No,
So
but
if
the
she was,
patient will be like this. You
if
were
she
still
was,
polite.
if she was more confident, and then really stand what she's speaking,
Yes,
then somehow the patient, I think,
will be
will
convinced.
accept, because
Yes,
patient doesn't know much, because
she
clean.
is
I
telling.
mean,
Yes, yes, agree. Good. My yes. Right. So if you have read and understood, considering it clinical examination station, kindly begin.
Okay, I will enter the room. I will wash
Yes.
my hands, introduce
Yes.
myself. Hello, my name is Dr. Farha. I'm one of the exam candidates, and then I will ask for his name and age, and afterwards I will explain the procedure. Today I have been asked to examine your life, in which it includes feeling, looking, feeling, and moving your life. Will that be okay? Again, and in consent.
Yes.
And then afterwards, I will start off with patient will be in lying position and ask him to remove his gown, or will be in his shorts only for
Okay.
dignity purpose, and position him supine on the couch.
Good.
And then afterwards, I will start with the hand examination and overlook. I will look for the nicotine staining.
Good. And
uh, and infarcts, nail or skin changes, showing any arterial disease like shining skin, thin skin, or hair loss, and tendon xanthomata as well. Then afterwards, I will check the capillary urethra and radial pulse, and
very
then
good.
I'll check the pulse on the second arm, as well as check the radial delay.
Good.
Then I will move to the localized examination, in which I will inspect the legs. I will inspect the legs for the skin changes, thin skin, shiny skin, hair loss, any ulcers, venous ulcers, or yeah, signs of venous insufficiency, venous guttering. I will check in between the toes for an ulcers. I will check for the atrophy at the toes, any gangrene or amputation. I will check from behind as well. And afterwards, I will start from palpation. In
Good.
palpation, I will check the capillary refill. I will check the temperature by the dorsum of my hands, from distal to proximal. And then afterwards, I will check for the Berger's angle. For Berger's angle, I will ask the patient if he has any pain in the hip joint. Then I will raise his leg at 10 degrees for the 10 second, and then repeat 10 degrees for the 10 second, increasing 10 degrees each time. And notice the pillar or changes in skin.
Good.
Whenever the normal one is up to the 90 degrees.
Good.
And then I will swing back his leg to the side of the couch and ask him to sit down and see if there is reactive hyperemia. That will conclude that our Berger test is positive. Afterwards, I'll ask him to lie down again. I will check pulses from distal, proximal to distal, from femoral, then popliteal, then dorsalis pedis, and posterior tibial. Uh, and I will also do the handheld Doppler for dorsalis pedis and popliteal. And I
No,
will
not for
also,
this one. Okay. Okay. You did you check the did you auscultate the iliac and the femoral buoys?
yes,
Then
then
you
afterwards,
have to check the ankle brachial pressure index. ABPI.
afterwards I will check brachial pressure. I will check the
Okay.
auscultate for buoys, ilian and femoral, and then I will check for the ABPI area ankle brachial plexus by taking BP from brachial arteries, right and left, and for the affected side, uh, posterior tibial and
Yes.
dorsalis
Now
pedis.
you'll do the Doppler at the end.
Okay.
Okay.
Whichever the highest level divided, that will
Yes.
be our.
Yes.
Then I will remove the gel and thank the patient, ask him to dress up again,
Very
ask him
good.
if he needs my help.
Good. Can you summarize? You still had 1.5 minutes, but still, once you will be doing it on patient, this time would be enough. Okay.
That-
Can you?
Mhm.
Yes. You wanted to say something? Otherwise, you can
Yes,
present
that
your.
I will be doing, that will take time, taking
Yes,
blood pressure
definitely.
and
Everything. But yes, now you can summarize your examination, please.
okay. To complete my examination,
Very
I would
good.
like to perform full neurological examination, cardiovascular examination, and upper limb vascular examination. I would like to check for the abdomen aortic grooves or aortic aneurysm.
Yes.
And today I have examined the 72 years old gentleman who came with claudication pain. I kept his shorts for dignity purposes.
Yes.
On inspection, there were signs of chronic ischemia, including pain and loss of hairs and venous scattering.
Yes.
And on palpation, there was that slight decrease in temperature
Okay.
and delayed capillary fill. Berger
Okay.
angles were 40 and Berger sign was positive.
All right. So what are your main differential diagnosis?
My main differential diagnosis will be atherosclerotic or diabetic peripheral vascular disease.
Very good. What images do you advise to carry out?
I would like to get the arterial duplex,
Yes.
ultrasound, the angiography, or MRA, magnetic resonance angiography.
What labs would you consider important for this patient?
I would like to get his lipid profile done and blood glucose levels done.
Very good. And what are the treatment options that you can offer to this patient?
This patient needs an assessment for the risk factor as he is also already hypertensive and hypercholesterolemic. He needs to have that control with
Yes.
control pressure and optimize cholesterol levels and sugar levels. And also he needs to be started on antiplatelet regimen.
Okay.
Or he might probably need a surgical or endovascular intervention, which could include stenting as well as surgical. If the limb develop gangrene, then it could lead to amputation.
Good. So what is the critical limb ischemia?
And
can you define the term? What is
critical limb ischemia defined as the presence of ischemic pain at rest or loss of tissue from gangrene or by ulcers. It is consistent with a PPI less than 0.4.
Very good. Good. Thank you. You started your timer and here is your question. Right. So if you have read and understood, considering the communication skills station, kindly begin.
Hello, I'm Dr. Muhammad, one of the surgical doctor. They have been asked to speak to you about your child. Are you okay with that?
Yes.
Hello?
He said yes. Continue, please.
Okay, thank you. Can you have a seat, please? Here is the tissue for you. Can you please first tell me what do you know so far about your child?
Can you tell how much you know about your child? Dr. Mohammed, confirm the relation with the patient first, with the child. Who the lady is.
Okay. May I confirm who I'm speaking to, please?
Is he here or
Dr. Shuaib? Oh,
Dr. Saddam? Can you hear? Can you hear? Can anyone else continue, please? Yes.
hello.
you-
I'm Dr. Muhammad, one of the exam surgical doctor. Today I have been asked to talk to you about your child condition. Are you okay with that?
Yeah, doctor, where's my daughter? Doctor, is she fine?
Okay, first, may I
Where is she,
confirm who I'm
doctor?
speaking to, please?
He
Okay,
wants to
first have a
confirm.
seat, please. Can you have a seat, please?
Okay,
For you.
I'm really worried, doctor. I haven't seen her since morning, and suddenly someone calls me and then tells me she's in the hospital. You know, doctor, where is she? Can I see her?
I'm really so sorry to hear that. But firstly, can you please tell me what do you know so far about your child condition?
I don't know much, doctor. I was just called and then they told that she was suddenly brought from the school to the hospital, and then I don't know what actually is the problem with her, doctor. Can you tell me, doctor?
Okay, firstly, your child has been brought by her teacher to the hospital, and our first investigation revealed that she has mild acute appendicitis, which is the inflammation in the appendix, which is part of her gut in the tummy. And now she is receiving IV fluid and antibiotics, and we are waiting for the surgeon to operate on her.
What appendicitis? Is it really serious, doctor?
It could be serious. It's as in children, there is only small amount in fat in the tummy, so there is a chance of perforation. So yes, it might be sent to some danger.
So what are you going to do about her, doctor? Will she be
Uh,
fine?
Yes, I understand your apprehension towards this, but now we are waiting for the consultant to operate on her, and now she is receiving IV fluid and antibiotics.
Operate? You mean she needs to undergo operation? She's just
Yes,
a little girl, doctor. Like, why operation now, doctor?
I'm sorry for that, but this her condition is she needs operation, as we cannot make sure that 100% until we operate on her.
So you're not sure, and then you want to cut her open.
I'm sorry for that, but our first investigations and her symptom and signs denote that she has acute appendicitis. And unfortunately, we cannot 100% make sure until we operate on her.
So you're not sure it's appendicitis.
Till now, but about 90%, yes, it is acute appendicitis.
And you are going to cut her to confirm it.
Yes, unfortunately.
Oh, doctor, is there any other way? I mean, without operation? I think
No,
now I remember. Now I can recollect. I had a neighbor, and his son. I think it's the same problem. This appendix, and I think they didn't operate on him. You know, he was back home in 5 days. How come, doctor? Why is it different with my daughter?
first, I feel sorry for your neighbor. Can you please tell me when and what was exact problem with him?
No, it was few months back.
Human?
Yeah, a few months back, doctor.
Few months back. Okay. And what was the exact? Yes.
They
Tell
said
about
it's
the, yes, about this patient. How much would be the scar and what are the risks or the complications it can lead to?
Okay.
doctor. If you really need to operate on her, what are the risks associated? Like, is it risky?
Yes, it has some risk on the risk for her subfertility. But you don't have to be worried. I understand your apprehension towards this, but she might be her reproductive tube as another side will be functional normal.
How big
And
is
also
the
we
scar going to be, doctor? Is it going to be a very
sorry.
big scar?
No, the scars is she will have a horizontal scar in her tummy, but we might need to change the wound. So this
Yes.
will be disfiguring.
Okay.
God, she's just a little girl, and then she's going to have scar now. Who is
Only
the
for
surgeon?
sorry,
Who is the surgeon? May I know who is the surgeon?
he's Mr. Lad.
Oh, Mr. Ladd. No, 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 no. You know, doctor, I think he is the same person, who operated on my husband few years back. And then, my husband died few days after surgery, and he couldn't save his life. No, doctor, I'm not getting my daughter operated by Mr. Ladd. No, no, doctor. Please
I'm so
arrange
sorry.
someone else for me.
I'm sorry to hear that. Please to accept my sincere apologize. But can you please tell me when and what was the exact cause?
It was 1 year back,
Mhm.
and they said my husband has cancer in his colon. And then Mr. Ladd, he's the same surgeon. I remember now.
I'm really so sorry to hear that. But cancer identifies is two different conditions. Uh, your your husband might have died of cancer, but not because Mr. Lack, because he has one of the excellent surgeons here in the hospital.
No, doctor. However expert he be, I don't want him to operate on my daughter. I need a different surgeon. I don't want Mr. Ladd.
Okay, I will arrange this with the hospital.
No, that would be great, doctor.
Okay.
Can I see Can I see my daughter now, doctor? Can I see her? Where is she?
Of course, I will arrange this. I will tell you later. So before we end up, let me summarize what you have been through. Your child has brought to the hospital by her teacher, and our health investigation reveals that he has acute appendicitis, and we are going to operate on her. And also, you understand this and the benefit of the surgery. And now she is receiving antibiotics and IV fluids.
Okay, good.
Okay. Okay.
Do you
So can
have
I see her
any
now?
other? Yes,
No, I
you
don't
can
have
see.
other query. I want to see her, doctor.
Okay, if you have any query, I will leave my phone number with the name. Don't hesitate to contact me. And thank you for your understanding.
Thank you.
Good. So